So the first step is to have a well-trimmed model. You only really need about to the premolars because our matrix is only going to extend about to here. For this case, we're going to be just bracketing the anterior 6 teeth first. What I like to do first is to mark the long axes of the teeth, and this just helps you better position the brackets. The nice part about doing this indirect is you can isolate the teeth. You can just pick one tooth and see just down the long axis of the tooth to kind of get rid of all the other things that you're seeing. But the other reason I like indirect bonding is because in the mouth I'd be trying to do this with a mirror and figure out where I was at. Here I can turn the model any direction I want. I can look from the front easily. I can look down this way. I can go pretty much any way I want with zero stress and no tongue or lips to get in my way. So now that I have all my marks, I can go ahead and start placing my brackets. Now to place the brackets, I'm just using my bracket plier, holding it down the long axis of the tooth, getting it centered. And I just put my finger on top of it. And I'm going to use some flowable composite. This is just some composite that I had in the office that I don't really use anymore. It doesn't really matter. And I'm flowing a little bit of composite on each edge of the bonding jig. And then curing it. But to me, this is a lot less stressful than having to do this in the mouth. Then it's easy to evaluate it. If you don't like it, you can just pick it off, remove the bracket, the composite, and redo it again. In the mouth, if you get one wrong, as you know, you have to pop the bracket off, clean the bracket, and repeat it. This way it gives you a lot of leeway, so you have a lot of time to make sure those brackets are just right in the right spot. Now that you have your brackets placed, you can check them. I mean, you have all the time in the world to check to make sure they're how you want them. If you don't like something or something looks askew to you, just go ahead and pop it off of there. You can pop the composite off and reset it. Okay, so now we're going to use the Emaluma, and the Emaluma is the soft setting vinyl polysiloxane. It doesn't get hard. And we're just going to cover each of the brackets with the Emaluma. This just keeps the Lumalock from locking on the bracket and not being able to get it off. You can usually do both arches at once. I'm just showing you one arch at a time. So that's the Emaluma. And after that, we're going to put the Lumalock, which is the heavier setting material that sets rather stiff. And for this, I'm just going to go back to about the second premolar, sometimes even the first premolar, and make sure you're getting it all the way around the teeth, pushing it in all the interproximals so it's really accurate in all those little spaces. And we're going to cover right over the emaluma. You don't have to go overly thick. This material is pretty stiff. And I don't go all the way down to the gingival margin. I just kind of stop and let the emaluma be that margin. And then I will let this set. Okay, so now this is completely set, and we can go ahead and take this matrix off. You can just kind of peel it off. So just kind of free it up around the edges, and usually it'll just pick right off of there. Okay, so now you have the brackets in the matrix. So now what I do is I go ahead and trim this up a little bit. I especially trim along the gingival margin on the facial just to bring it up to the level of the brackets, just so my light gets a little bit better in there. And the most important place really is, you know, the indexes on the incisal edges. The other thing I like to do is I want to pick out these little pieces of composite. So I'm going to go along each of these and pick out the composite that's around the jig. And I do that only because sometimes the composite will break a little of the stone, and not only will you have just composite there, you'll have stone, which would prevent your matrix from seating all the way, or your index. So I go ahead and pick all these out. Once I do that, then I go ahead and make a little index. So right in between the two centrals, I'll make a little V-shaped notch. And that's going to help me position that back in the mouth effectively. And that took me to place the brackets, took me about 5 minutes. And that's all you need to do. And then we'll go to the mouth and place these. We have Lexi here today. We're going to show you putting her brackets on today. Oh, I don't need my light. So first we're going to pumice these teeth, which just gets them really clean for us. Maybe close your eyes just a little bit, because sometimes this stuff kind of flies around a little bit. I'll just try this matrix on first, make sure everything fits well. Okay. For this we're using G-Bond, which which I like very well. It works very well. To bond the brackets, I use a product called Genial Flow from GC America. I like this product because it's fairly viscous and it stays right where you put it. You don't want to overload these brackets because then you're just going to have to clean up a lot of flash. So just put enough to cover the meshwork. Okay. What I do is cure one of these brackets at a time. So I'm pushing down to make sure my matrix is all the way down, and I'm also pushing against the matrix with the light, curing each one. And my assistant helps, and we're going to cure this from all different directions, especially up by the gingival where the matrix is the thinnest, so we get a lot of light through there. And what I do, it doesn't really matter which way you take this off, but it works just as well for me just to take it off from the facial, so I just kind of free it up with a little spoon excavator. Okay, suction again. I got a couple pieces. Well, I'll just give them to you here. It's all right. And then what we'll do is just cure these again. Now that we have the matrix off, just to make sure they're well cured. So now usually you only have a little bit of flash. And that's going to be at the top or the bottom of the bracket. Usually it's right here at the top. So you just take a fine burr and just remove that flash. If you don't put too much in, you're really going to have very little flash to worry about.